Good afternoon, everyone. It is 2:30 and welcome to our Monday, December 28th COVID-19 update. For those who are celebrating, I hope you had a very Merry Christmas. We got our snow, so we had a very white Christmas, as we all know, and I want to thank all the Department of Public Works workers who had to work on Christmas Day and the day after Christmas, some long hours. Thank you for your good work. Of course, you'll hear from Dr. Gail Burstein, and we're joined by Kendra Schmidt from Deaf Access Services. We have a lot of information to cover, and let's get started. As of December 26th, there were 39,160 unique COVID-19 cases in Erie County. The 7-day positivity rate has dropped. It's down to 5.6%. The total deceased is now 1,131, but this has not changed in a number of days. Because of the holiday, we usually get information from Healthy Link on Tuesdays and Fridays, and of course with Friday having been Christmas, we didn't get any information from Healthy Link on deaths that we can then confirm. So we're expecting an update tomorrow, and we do anticipate that it will go up. Hospitalizations on December 26th, there were 471 people hospitalized with COVID-19 in Western New York hospitals, 76 in the ICU. Of the Western New York patients, there were 390 patients in Erie County hospitals, 69 in the ICU, 44 were on an airway assist. Unfortunately, 6 died in the hospital on December 26th, and 38% of the patients that were COVID-19 positive in the hospital were actually 64 and under. I did note that our positivity rate has dropped. It is the 4th week in a row our positivity rate has dropped. That's a good thing. We also had another drop in the total confirmed cases, even though we pretty much had tested the same amount of people as we had in the prior weeks, only off by about 1,500. So we actually did pretty good with the positivity rate and the cases going down. I should say pretty good with them going down. It's not great. They're still a little higher than we'd like to be. But we have had a 4-week decline in the positivity rate. Once again, the positivity rate for the week ending December 26th was 5.6%. New COVID cases by zip code for the week of December 26th, and Lancaster is leading once again with a pretty high rate of 77.6 cases per 100,000 population, followed up by Tonawanda with the largest cases, 14150 zip code, 166. We hadn't seen Tonawanda this high in quite some time. We also had an increase in the east side zip code, 14215. With 149 cases. So we just want to remind everyone that COVID-19 is still out there. It's in the suburbs, it's in the city, it's in the rural areas, and we just want everyone to do the best job possible to protect others, wear those masks so that we can get back to normal business. We want to get down to the yellow zone and no zones, but to do that we have to keep our rate down. Hospitalization data from December 12th to 26th, and on the 26th, as I noted, already 390 people were in the hospital. The lowest bar, the red color bar, or orangish rust colored, is the one that is very sad. That's the best way to put it, because it is the number of deaths in the hospital each day. As we said, 6 died on the December 26th. That's actually the lowest number we had in over a week. There were 9 people that died in hospital on December 25th from COVID-19. 9 the day before, 9 the day before, 16, 13, 16. So the last week has been a bad week when it comes to deaths. We have seen basically the COVID-19 population in hospitals in Erie County stay stable. We haven't seen it really grow, but it really hasn't dropped either in the last week to 10 days. We want to see that drop. Mortality data, this hasn't changed as we talked about from last week, and so we should have a more updated report tomorrow. But more than half of those deaths are in the 80-plus age group, and we will certainly get the update tomorrow from Healthy Link and release it later tomorrow afternoon when we have the updated number. I'm confident, though I'd rather not be, that when we get the updated numbers, we will actually surpass the highest number of deaths that we had in any month, which was April. And here's a very sad statistic. 1 out of every 1,000 Americans have died from COVID-19. The U.S. population is a little less than 330 million, and the U.S. deaths through December 26th are 333,000 estimate, or basically 1 out of every 1,000 Americans have died from COVID-19. Erie County responds. I'm going to turn over to Dr. Burstein to talk about vaccine delivery and some of the issues that we are dealing with. So.
Thank you. Good afternoon. I know people are so excited about getting immunized to protect themselves against COVID-19, and many frontline healthcare workers working in the hospitals or affiliated with the hospitals have been immunized, and more are getting immunized. So, and people working in nursing homes, remember, Erie County Health Department currently does not have any immunizations. So it's really up to the state. So far, they've given this all to the hospitals, and they've been immunizing. We don't expect, with all the priorities that the state has, that we will get to the general population until the next few months. Our priority populations this week, according to the governor's press conference, have expanded, as well as the people working in the front line in the hospitals and EMS and our funeral workers. We're also able to immunize people working in urgent care centers. People actually providing the COVID vaccines are going to be able to be vaccinated themselves, and then residents of OHS facilities. Next week, it's going to expand even further to ambulatory facilities and many frontline-facing healthcare workers that are, working with COVID-19 patients. And so I just want to point out good news that the New York State Health Department over the long weekend was able to change their quarantine guidance. So it's closer to CDC's guidance, whereas in the past, quarantine was 14 days. So now it is 10 days after the last day of exposure. However, that people still, for those 14 days, even though they're out of quarantine after 10 days, they still have to continue to engage in these protective behaviors and non-pharmaceutical behaviors like wearing your mask, washing your hands, social distancing. Have to monitor your symptoms at least twice daily, and if you ever develop symptoms, get a test right away. And then also the Erie County Health Department strongly recommends that anybody in quarantine get a test between 5 to 7 days after their exposure so they can know their status. Remember, people are asymptomatic, and the only way you're going to know is if you get a test. So we have a lot of testing in Erie County. As the county executive pointed out, we have around 56 to 57,000 tests each week. So people are getting tested. If you want a test from the Erie County Health Department, people who are eligible are either people who are close contacts, so they are in quarantine, or people who have COVID-19 symptoms. So again, just call us at 858-2929 to schedule an appointment. All you need is an appointment, but please, if you have an appointment, make sure that you show it. These appointments are hot. So I'm going to turn it over to the county executive.
Thank you, Doctor. Previously noted that the controller has made some allegations about me in regards to a number of things in the past. And this morning, he actually alleged I played hockey yesterday. And today, this morning, he alleged I played hockey yesterday. I don't know if how I said that, but he posted on his Twitter page with a video, an allegation that I was caught red-handed with stick and hockey bag in hand, going to play hockey at the Northtown rink in Amherst. Well, I didn't hide it. I walked in through the front door and said hi to my friends because I didn't play hockey. I said hi to the people at the front because what I did is I came before my group that normally plays. I got there about a half hour beforehand and skated alone, doing a little skate and shoot on the ice. But what was interesting is his post included pictures of someone in the parking lot, I think 2 people who actually were stalking me. That happens. But I walked in the door, front door, said hi to the folks at the front, didn't put my hockey equipment on. I put my skates on, my helmet, my glove, my stick, and I went out and I skated alone on the ice. I left before they commenced their play at 7 o'clock. It was the first time I was on the ice since August. And I did nothing that was against the rules. Nothing. Simple as that. Any allegation to the contrary is wrong. And because I thought there was a chance that this might happen, I actually took a picture of myself skating alone on the ice at 6:45 a.m. And if you look at this picture, which is a shot like towards myself, you will be able to tell that the time in the background on the clock says 6:45. I did not wear full equipment, took a picture of my ice on the ice to prove it, alone, 6:45 a.m. The group starts at 7 a.m. I skated for about 15, 20 minutes. People came on the ice. I said hi to them. I wish them, I hope they had a Merry Christmas. I hope they certainly will have a very Happy New Year. I did nothing wrong, and if you want to confirm it, especially members of the media, you can contact Jim Fink of Buffalo Business First, who will confirm all that I'm saying. Why? Because even if I went out and skated with my friends doing drills, someone would say I was breaking the rules. So what I did is I skated alone, I took some pucks, shot it at the net. Goalie came on the ice, doing warm-ups, took a couple shots at the goalie, and then I left. It's as simple as that. And what's distressing is the controller just posted a video of my friends skating from November when I'm not even there to prove that I'm there or to prove that something's being done wrong. Our Department of Health has only closed one hockey rink, and that was due to an egregious violation associated with the Buffalo Regals organization, in which there were 3 teams that had COVID-19 outbreaks on them at that moment. The rink is now open. We have not closed any other rinks, and Holiday Twin Rinks is open again. Nothing that was done yesterday was in violation of any of those rules that we would enforce against anyone. And it's disappointing that, unfortunately, we've come to this, but it does happen in this time that we're in, and it leads me to talk about some of the other issues that, unfortunately, myself, Dr. Burstein, and others have had to deal with, including my family. That here I am going to a hockey rink at 6:30 in the morning to skate alone on a sheet of ice by myself and being stalked by others. Okay, that's part of the world we live in, but it's been pretty bad lately, and some of the things that I've had to deal with, Dr. Burstein's had to deal with, my family's had to deal with. We've received multiple threats lately. Unfortunately, my office has received many threatening emails and phone calls, some of them horrible phone calls, lately against myself, my family, and Dr. Burstein. And as was noted yesterday, I also believe I've been followed when out, leading to have increased security at my home, my office. I went cross-country skiing this past weekend. A girlfriend and I think somebody was following us then while I'm cross-country skiing while wearing my mask. It's gotten to that. But here's a few of the recent emails we have, and these are just a few. We've had many, some of them just horrible. I blacked out the bad words. But here's one from December 13th. We have concentration camps ready for you, Polish blank. Recall group has started for you and that Jewish blank. December 23rd, allegedly sent by myself. Listen here, you dumb blank. Keep up your blank. We will get you and your family. Leave, I guess it's the, area if you don't like it. We gonna get you. Here's another one from December 23rd. Grow eyes in the back of your head, you pathetic Polish blank. Public hanging needs to happen. Blank, you and your loser family. I know it's a tough time out there. I know not everyone's happy with all the rules that have been put in place, the protocols that are out there to protect people. I know it's difficult. That's why we've tried to help businesses, especially with our Back to Business grant program. But as Dr. Martin Luther King Jr. said, we must learn to live together as brothers or perish together as fools. It's as simple as that. Our country, our community, our people cannot continue if we are at constant war with each other. And the threats are horrendous. I've learned to live with it, but families shouldn't have to learn to live with it. Dr. Burstein shouldn't have to learn to live with it. Her family shouldn't have to learn to live with it. My staff shouldn't have to learn to live with it. We need to be everyone better. We must learn to live together as brothers or perish together as fools. And during this terrible time when we've had to deal with these really bad issues, there are good people out there, good people who unfortunately we're losing. And someone who unfortunately passed away yesterday, not from COVID, but we lost Paul Murphy, a very popular member of the Erie County and Buffalo and Convention and Visitors Bureau family. Paul was the general manager of the Buffalo Niagara Convention Center. He helped us earlier this year when it thought we were going to have to turn the convention center to a COVID-19 only hospital. He learned earlier this year of a serious illness that was facing him. I know he fought it with dignity, and I know on behalf of each and every one of us in Erie County, we are deeply saddened by his passing, and I offer my deepest condolences to his loved ones, his wife Kim, his family, his friends, everyone out there. We need all the good people we can get in this time, and we lost a good one yesterday. So on behalf of the people of Erie County, I just want to finish this portion of the press conference in memory of Paul Murphy. And before we take questions, I'd like to take a moment of silence in his memory, as well as the memories of those we've lost in 2020, which has just been a horrible year. So if you can indulge me for a moment, I'd like to take a moment of silence. Thank you. We'll open it up to questions now. The first question from Ali Tui of Channel 7. You have to unmute your phone if you are muted. I think it's *6.
Hi, County Executive. Sorry to keep you waiting. Appreciate you taking my question. I know you've already addressed what Stefan Mihailu is accusing you of. Just to follow up, I know he had posted the video from November 15th. Were you ever aware of any type of scrimmaging happening at Northtown?
No, my friends play drills and different types of small area games, things like that. I'm not aware of it. I've not received any. We know that some rinks do better than others. Our staff has gone out to rinks, and it's not. I'm not here knowing of any particular violations. As I said, the holiday rink one was different. There was an outbreak on 3 different teams, it appears. There were 3 teams that were shut down, and we believe that there was an at-risk game that was going on among players on the ice at that point. They have a reopening plan. They've reopened. My goal would be to get everyone back playing as quickly as possible. Our numbers are going down, so if we continue in that direction, then hopefully we can get traditional games back being played. I'm just disappointed by the continued spurious attacks, but whatever. I guess in this business, I learned a long time ago you have to have thick skin, and I'm just disappointed that he even went after and included a video from November 15th. I'm not even there. And if you look at my buddies on the ice, they're not skating that fast either. So it's just disappointing, but it's what I've come to expect from him. Channel 4, George Rickert. George, are you there? *6, if you're muted. We'll come back to George. Ron Plants from Channel 2. Ron, are you there? Are there people there?
Can you hear me, Mark?
I can hear you, Ron. Go ahead.
Okay. Going back to the Bills, obviously playing tonight.
Go Bills. Beat the Pats.
Yeah. Well, last week you kind of indicated that you felt perhaps, and I'm going to use the word, maybe you don't want to say it, but blindsided by the state and the Bills apparently working on this experimental program. Have you had a chance to since talk to them, and how do you feel about it now?
Well, if you remember, Ron, I originally said on behalf of the county we felt that we could get 7,000 people, which is about 10% of the population, in safely. We were concerned about the tailgating, and that's why the Bills in their proposal agreed to not allow tailgating. Basically, you come in and you go into the stadium. And what surprised me was the governor's announcement. We knew that there were some discussions in the past. Since then, I've had conversations with both representatives from the Bills and the state. As the governor noted, I think earlier today, they still are having some conversations, but nothing definitive has been made. Early on, we said we thought we could get 7,000 in safely. It was in the state's hands. The state has now talked about potentially doing testing. We could not test that many people all at once. We just don't have the capability of doing that. If the state can do it or the bills can do it, I said we can get 7,000 in. We think we could get 7,000 in. If the state wants to limit it to 6,700, okay. But right now, that is, as of today, at least a couple hours ago that I'm aware of, after conversations with staff from the governor and recent conversations I had with the bills, I don't think that any decision's been made. I'm hoping just that we all enjoy today's game and beat the Pats, which would be the first time in quite some time the Bills sweep the Patriots, and then face the Dolphins in that final game, and get ready for what will be a home playoff game. There's no doubt about that, and hopefully there will be fans. We're doing our best, and we need to get an answer soon from everyone just so that we can prepare, because as I've said before, the team that's intimately involved also in the vaccine delivery as well as the COVID-19 response are some of the same people who would have to be at the stadium on game day to ensure the safety of the fans. Just go back quickly. George Rickard, are you there?
You hear me okay?
Yes.
Hello?
Hi, George.
Okay. Hi. What would be next for the orange zone and yellow zone? I know that's a state decision, but there really don't seem to be any parameters in place for falling out of the orange zone. What's your understanding of when the next best hope for the orange zone businesses to get loosened up rules?
Well, the one thing we are going to provide them, George, and I'll go back quite a number of slides, is the key data is this weekly data, which continues to show a drop in the positivity rate. We need to see that continue to go down. We'd really like to see it at a 3% range. I think if we could get it to the 3% range, then we're probably going to go back to yellow. But we have seen a little drop, and we can see over the last 4 weeks, thankfully, but we do need to continue to see that drop. So that we are showing the state that we are doing better. Now, the governor earlier today noted in his press conference that Western New York is doing better. And I'm hoping that he takes that into consideration with others. We are advocating to at least go back to a yellow for the vast majority of the area. We believe that we can safely do that with having interior dining allowed for no more than 4 people at a table. We do believe that that can be done safely, but we need that number to continue to go down. And that information has been shared with New York State. The governor has noted about our better numbers. But as I said before, once you get into an orange zone or a red zone, it's going to take you a while to get out of it, and we're kind of seeing that right now. But at least the trend is heading in the right direction. Spectrum News. Anyone from Spectrum?
Hi, Mark. Thanks for taking the question. On that line of, getting out of the orange zone, have you, in any of your talks with New York State, has there been any timetable that they think could be for getting us at least into a yellow zone?
Well, I think one thing we're looking at right now is was there a Christmas bump? I feel pretty good that everything I've heard about Christmas Day, and truthfully the 26th and the 27th with the snow, is we've avoided a lot of those big mass gatherings. Travel on the 25th was pretty light from what I've been able to gather and heard from Department of Public Works crews and others. So there wasn't a whole lot of travel going on the 25th, which is a good sign. I think we'll have a better idea in the next 5 or 6 days if we get a bump up in cases that we could then attribute in all likelihood to a Christmas bump. If we don't, I think we're in a much better spot to see us go down to yellow. As I said, we really like to see that decline to about 3% weekly testing rate. But if we continue to head downward, and that's why this week's going to be really key, because it's usually 5 to 6 days after you've contracted the virus that you start to see the symptoms, and that's when people come in to get tested. So I think we'll have a much better idea by the end of this week. I'm hopeful that very soon we can move back to the yellow. We think based on our numbers we could do it safely, at least to allow inside dining for no more than 4 people at a table. But we've done better as a region, and that's the hope, as we continue to do better as a region. Buffalo News, is anybody on from the Buffalo News? If not, we'll go to WBFO. Michael Desmond, welcome back. Are you there, Michael?
Yeah, nice to be back. Question, this is more for Dr. Burstein. Do you have any sense of, for example, how soon you'll have all the first responders and nurses in the nursing homes and so forth? When will you start moving to the state's 1B group?
Well, I can say that, first off, we're not administering any tests, though, or not tests, vaccines, I should say, though we just got authorization last night from New York State to assist in the vaccination of approximately 1,000 EMS workers, and I'll let it turn over to Dr. Burstein. As while we have not received any vaccine yet, it's still going to the hospitals and the nursing homes. We feel we're going to be in a better position because New York State is now allowing us to perform some of the vaccines.
Thank you. Thanks. Welcome back, Mike. So, as County Executive mentioned, we were authorized to administer about 1,000 vaccines to people in the already 1A category that have been approved for vaccination. So that'd be primarily our EMS, our first responders, also people working in funeral homes, medical examiners, and what was on his list. So currently, as the county executive mentioned, we do not have any vaccine, so we're hoping to receive it this week. If we could get more vaccine, we would be able to open up pods. We have a very strong plan where we'll be able to open up several pods throughout Erie County and have an army of people that would be ready to immunize. One thing that's also holding us back is that many of our immunizers that are going to be up and running and prepared are pre-hospital staff, so that's EMTs and paramedics. The state was supposed to release training for those workers to be eligible to immunize in New York State. They've been, so far we haven't seen that training, so we have a large number of potential immunizers that so far are not able to immunize because we're waiting for this COVID-19 vaccine training to be posted. So that's another hurdle. But we can, we will be able to immunize thousands of people a week once we can get our staff up and running, our pods set up, and a big supply of vaccine. So the supply of vaccine is a big rate limiting step. Thanks, and I'll turn it over to County Executive.
I will note that we did have a vaccine hub call this morning with representatives from the Western New York leaders, plus the leadership of the vaccine hub locally, which is Mark Sullivan and his team at Catholic Health, Tom Croce and his team at ECMC, and Dr. Michael Kane and his team, including Dr. Nancy Nielsen from the medical school. And we are moving forward as best as we can, though we are still at the mercy of New York State when it comes to vaccines because they are the ones delivering the vaccines to us. WBEN Radio, any questions? Anybody on? If not, I believe we have another affiliate from NBC affiliate from Rochester. If you could just identify yourself so we know who it is.
Sure. Hi, County Executive. My name is Jennifer Lukey. I am a reporter at the NBC station just on the Thruway in Rochester. And I wanted to ask you, the governor has praised you in Western New York lately for going from one of the highest infection rates to one of the lowest, or I should say positivity rates to the lowest. Can you attribute, what are you doing to lower your rate, and what can the Finger Lakes region learn from Western New York?
Well, thank you for the question. County Executive Adam Bello and I have had multiple conversations over the last year. Definitely a very difficult year to have his first year in office. And I know him and his team, Dr. Michael Mendoza, are doing as strong a job as anyone possibly can. I think it's important that we note that it wasn't that long ago that the governor was noting that Western New York, including Erie County, was the worst in the state. So what we did was just continue to get the message out to the public that we are all in this together. We are our brothers and sisters' keeper. We have to wear masks. We have to follow the protocols. We're not happy about having to shut down restaurants. We're not happy about having to shut down gyms or barbershops and beauticians. But that is where there was in the past spread, when it looked like it wasn't affecting it as much, so they allowed the opening of gyms and barbershops and beauty parlors. But it comes down to the most important thing is this mask. And what you will see if you're in Erie County and in Western New York is there's mask wearing. It may be begrudgingly, but people wear their masks when they go into the store. When I was cross-country skiing in Delaware Park in the city of Buffalo this weekend, I was coming across people walking their dogs, wearing their masks. People sledding down the sled hill, wearing their masks. So it came down to, we were telling people if we did not follow the prescriptions from our friends in the health community, we were going down a road that we might not be able to get out of. And people took it seriously. They took it seriously to the point where they stopped the small gatherings. If they had a small gathering, they really limited their time around the other person and they wore masks. We were getting reports from everywhere and anywhere. You can imagine small gatherings, and then we heard about less and less small gatherings. And also, I think this is a big reason why. Earlier in the spring, when we were dealing with COVID-19, very few people knew someone who had COVID-19, and a very limited amount of people knew people who died from COVID-19. That cannot be said from what happened in our community starting in September and really in October through November, where everybody knows someone who had COVID-19, and pretty much now everyone knows at least someone who died from COVID-19. And it told people, this is not a hoax, this is real. If this person could die from it, my family member could die from it. So it sent a message out to the greater community. I know they're working very hard. I certainly commend County Executive Bello and the Health Commissioner, Dr. Mendoza, on their work. Dr. Mendoza, I know, talks with Dr. Burstein here, and I'll allow Dr. Burstein an opportunity to comment as well. I talk with Adam, and we share information. I'm disappointed from a standpoint of seeing what's happening in the Finger Lakes region. I just hope that they can do what we did here, which is take it so seriously that people realize you can lower your rate if you wear the masks and you drop the small gatherings. Doctor?
Thank you. Thank you. I mean, I just want to echo what the county executive reported. I know Mike Mendoza is working, really hard with his health department team, and they have even a smaller health department than we did to get everything that needs to be in place to be able to test, to be able to contact trace, and to be able to enforce. I just want to turn it back. It's really not just the health department or the governor, the government. It's really our numbers depend on our own behavior. So we're fortunate that Erie County residents were able to turn it around and listen to public health pleas, to mask as much as you can, social distance as much as you can, try to minimize any type of gathering, large or small, and it seemed like people have been doing it, and it's worked. And so I really want to commend Erie County residents for pulling it together and listening to our pleas and adhering to the safe, protective behaviors that are keeping our numbers down. So just want to turn it back to the communities. It's really the numbers are reflective of our behavior. So if our behaviors can be safe and do what we need to do to prevent COVID-19, our numbers will go down. Thanks.
Thank you, Doctor. We have time for one more round of questions. Ellie Tui from Channel 7, do you have any more questions? Or someone else from Channel 7? If not, we'll go to George Rickert, Channel 4. Any more questions, George?
Hi, Mark. Real quick follow-up on the bills. You had said you need to know this week, or you logistically, the bills in the county would need to know this week if the state is going to go forward with this. Is that still the case? I mean, what day, if do you need to know before Friday? What would be the timeline now for at least knowing?
Yes, we need to know this week because we have to call in staff. There's security that works for these games inside and outside the stadium. There's personnel related to EMS that need to be called in. That are not county employees. They're certainly county employees we have to designate. Our hope is that if they would let us know by Wednesday, so in 2 days, then we could get this all pulled off. And the other thing I continue to note is the individuals who are intimately involved in the game day operations on behalf of Erie County are those that are intimately involved in the COVID-19 and vaccine response, including our Department of Public Works and the Commissioner Bill Geary and his staff, the Department of Health, the head of Emergency Medical Services, our Deputy Commissioner Gregory Gill, is actively involved, of course, as you can imagine, in the COVID-19 response. Our Department of Homeland Security and Emergency Services is actively involved with Commissioner Dan Neverth and Deputy Commissioner Greg Butcher. Almost all of them are always at the games, and they have sub-staff that are doing multiple functions right now in the COVID-19 response that would also have to be available for the Bills game. So we'd have to find the appropriate work for all these individuals, and because there's also work that has to be done before the games in preparation for the games. So the best time we really need to know is by Wednesday. If they announced it at like the end of next week, we might be able to pull it off, but I don't know if the Bills could, because then you remember, you got to identify ticket holders and sell the ticket holders and then test them. So I think this Wednesday, I should say, is the date that's really best for all. Channel 2, Ron Plants, do you have one more question? If not, Spectrum News, any more questions?
Hey, Mark, quick question. How are your county hospitals dealing staffing wise? Are they overwhelmed, or do they for now seem fine being meeting all staffing needs?
I'd ask you to really direct that question to the hospitals. The county does not own a hospital. Erie County Medical Center Corporation is a separate entity. And having talked with Chief Executive Officer Tom Crotrochi, it sounds like they're in an okay position right now. But same, I think, goes for Kaleida and Catholic Health, but you need to really talk to the leaders there. I know that there's a lot of frontline workers in hospitals that are highly stressed and truthfully burning out because they've been doing this all year. So in addition to what they normally deal with, cancer, accidents, you name it, all kinds of other illnesses, they now have to deal with these large numbers of COVID-19 patients, which have to be segregated from the rest of the hospital population, so it puts a big strain on the hospital systems. They're hanging in there, but I think the one that would be best to answer that are the leaders at the 3 hospital units. Buffalo News, last chance. Anybody on from the Buffalo News? Anybody there from the news? Mike Desmond, any more questions?
Yeah, Mark, following up on what you just talked about, are you know, first responders have various psychological helping methods. They have post-event meetings and what. You have to be getting people who are just plain burning out. Is there anything you can do?
Well, I can only speak from our county staff, and I do know that there are members of our county staff that are burning out, but we have resources available for them. It's also why I told people earlier in this year they need to take vacations. They need to take time off. Also goes for the person sitting over there, Dr. Burstein, because she likes to work. Because burnout is a serious, serious problem. And I know that resources are available at all the hospitals. We have resources available for first responders, EMS, EMTs, police, fire. And our mental health department offers resources. There are many resources that are out there. You can go to the Erie County Department of Mental Health's page, as well as the Erie County Department of Health's page for resources with regards to mental health and anxiety issues if you are at home and feeling it. It is a big concern, and I can tell you just from our own staff, they're burning the ends at both, or the candle at both ends, and that wick eventually gets in the middle and it just burns out. So I'm very worried about our own staff. I know some of our own staff have had to address these issues, and I'm certainly concerned about what's happening in local hospitals and other first responders because it's a difficult thing to deal with. And this is not the only thing that they're dealing with. We still have first responders responding to calls with regards to opiate overdoses. We have first responders responding to calls with regards to car accidents and fires and some horrible situations that they come to. And add on to that COVID-19. It's pretty bad. It's been a horrible year. I was hoping that 2020 would go out like a lamb at least, but no, we get a terrible snowstorm in which we had first responders and others working during that, and we lost one of the good people in Western New York and Paul Murphy, and I'm sure we're going to lose more people over the next few days. Let's just all hope that 2021 is better. Final question, is the affiliate from Rochester still on? Do you have any more questions? If not, I think we're all done. I'm not certain if we will have another COVID-19 update this week. Normally we do them on Mondays and Thursdays, and Thursday, of course, is New Year's Eve. If we need to do another update, we will, and if we do, it'll probably be on Wednesday. We may do one, we're not certain. We will certainly let the public and our friends in the media know. But I just want to finish once again in memory of Paul Murphy, who passed unfortunately yesterday after battling an illness for a few months now. Paul was one of the good guys and was respected by everyone, and it's just sort of indicative, as I said, of 2020. It's been a bad, long year, and on behalf of the people of Erie County, I just want to offer my deepest sympathies to Paul's family on his loss. Everyone, be safe and well, wear your masks, and let us all not celebrate the coming new year, but be hopeful that the new year is a good one after what we've had to deal with this year. Take care, be safe and well.